Hello, my name is Dr. Diwan S. Raja. Today I will discuss about chikungunya. Chikungunya is a viral disease transmitted to human via the bite of an infected mosquito. The species of the mosquito is the Aedes aegypti and also another one, Aedes albopictus. Primates are likely the main reservoir of the virus. And this disease was discovered in Africa in the country Tanzania in 1952. But it came to the limelight and a lot of discussion after 2004 to 2006, and it is now spread in multiple countries. A lot of patients now, especially for the tourist, it is a challenge. Human to vector to human transmission occur during an outbreak. Bloodborne transmission is also possible. It is found some laboratory technician accidentally infected them with the blood containing chikungunya. First 2 to 6 days of illness has the highest viremia and possibility of infection transmission. Maternal fetal transmission is possible, especially at the time of delivery. But before that, it is still possible, chance is less. Okay, so this is the Aedes mosquito. It bites during the daytime, and this mosquito carries the chikungunya virus. Okay, so this is very important. This mosquito also responsible for dengue fever. Okay, so both of them may be endemic in certain parts of the world. Chikungunya epidemiology. Chikungunya has a high attack rate and may affect 30% to 75% population in an area. Outbreaks of chikungunya have been occurred in Indian Ocean island like Mauritius and other islands, Caribbean island like St. Martin, like Sabah, like Puerto Rico, US Virgin Island, okay, Indian Ocean island like Reunion Islands, okay, Pacific island like American Samoa, or other like Solomon Island, okay, so many other Fiji, and also in Europe. Tourists get the disease if they visit the epidemic areas. Open water container like the in the vegetable garden, some pot containing some water, maybe in the flower vase area. Okay. Open water containers serve as a reservoir for vector breeding sites. The Aedes mosquito bites during the daytime. Any age group may be infected, and the native people of that epidemic area are not immune to this viral infection. Okay. About 3 to 28% of infected people are asymptomatic. Incubation period is 1 to 12 days. Disease is characterized by sudden onset of high fever, joint pain. This is very important. This disease is associated with high fever, maybe 102 degrees Fahrenheit, and joint pain, multiple joint pain. Even the person cannot stand and walk, rather he becomes stoop and move. That name came from chikungunya from African local language. Other symptoms include headache, myalgia, arthritis, conjunctivitis, nausea, vomiting, and maculopapular rash. Fever may last up to 1 week. It can be biphasic. Biphasic means initial few days, then it is going to the plateau, again going up. There is a biphasic fever may be possible. multiple joints are involved, including the most including the proximal joint also the peripheral joints, and the symptoms may be debilitating. Rash usually occur after onset of fever. Okay, so here are some of the picture of chikungunya fever, maybe 100 to 3 degree Fahrenheit, joint pain, multiple joint pain. Okay, not necessarily peripheral joint, also the proximal joint, we have pain, a lot of pain in our patient. Okay, headache, fever, rash, swelling, and muscle pain. Abnormal laboratory finding in chikungunya: thrombocytopenia, lymphopenia, elevated creatine and liver function test. Rare complications include myocarditis, uveitis. Uveitis is the inflammation of the uveal tract, that is the iris choroid. Okay, so the part of the eye that is they're composed of the iris, the choroid, and the ciliary body. Retinitis, inflammation of the retina. Hepatitis, acute renal disease, severe bullous lesions. Okay, that may happen. Neurologic diseases like meningoencephalitis. GB syndrome means Guillain-Barré syndrome with ascending paralysis may happen. Myelitis and cranial nerve pulses. These are rare complications. Vulnerable populations are, who are the vulnerable population? Adults greater than 65 years of age, people with hypertension, diabetes or heart disease, and certainly the pregnant women also vulnerable, especially during the last trimester of pregnancy, but it may happen first and second trimester also on rare occasion. And in that condition, we'll have multiple complications, like it may be abortion, maybe complication in the developing fetus, nervous system complication, cardiac complication, joint complication in the developing fetus due to transplacental transmission. Sequelae of chikungunya. Symptoms typically resolve by 7 to 10 days. Fatality is rare. 5 to 80% of patients may have persistent joint pain. Joint pain may be several years. Pregnancy and chikungunya, transplacental transmission is uncommon. However, if intrapartum transmission occurs, it can cause neurologic disease, hemorrhagic symptom, and myocardial disease in the baby. Rarely, spontaneous abortion happens due to infection during the first trimester of pregnancy. How can we diagnose chikungunya? Chikungunya is diagnosis based on the patient's clinical feature, like high fever and multiple joint pain and other features. And clinical feature, place and date of travel is very important. Suppose person is visiting the Caribbean island or the Pacific island or the Indian Ocean island, then they may develop chikungunya. Okay, and their activities also, people don't use the long sleeve dress. People may be prone to have mosquito bite, so do the activity outside. Okay, they may have possibility to get chikungunya. Laboratory diagnosis include testing serum to detect virus, viral nucleic acid, virus-specific IgM, and neutralizing antibodies. Viral culture or nucleic acid amplification on serum. Convalescent phase samples should be collected from patient whose acute phase samples test negative. That may happen. During acute stage, the organism may not be separated, but it may be separated during the convalescent phase. CDC is well equipped to test the chikungunya virus. So anyone like to get the idea, knowledge, and advice, they should call CDC. Okay, we got that. Now, so we got the CDC laboratory diagnosis how it is based. Then we must go to the treatment. There is no specific antiviral treatment. There is no vaccine. Treatment is symptomatic, like fluid, analgesic, antipyretic. NSAID is useful if dengue is ruled out to avoid hemorrhage as a differential diagnosis. In dengue, usually the joint pain is not so severe, but the blood count and bleeding tendency is more in dengue. Steroids, topical painkiller, and physical therapy may help. Okay, so we must exclude dengue fever. Prevention, avoid mosquito bite. There is no vaccine for chikungunya. Travelers with underlying medical condition like diabetes, age over 65, hypertension. Okay, so even the pregnant women should avoid travel to the epidemic areas. If travel is unavoidable, take necessary protective steps like long sleeve dress and also use the mosquito repellent DEET. Okay, that is very essential. Take necessary protective steps against mosquito bites. And that's all about chikungunya. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.